Welcome to Think Your Health, and I'm Dr. John. On this channel, questions and problems regarding your health are answered. And shout out to one of my viewers for requesting this video. Timestamps are included for the different sections of this video. Click on the description below. What is spironolactone? Spironolactone is a prescription medication. The brand name is aldactone. It belongs to a family of medications called aldosterone antagonists. Spironolactone is also referred to as a potassium-sparing diuretic. How does spironolactone work? This medication makes your kidney remove extra water as well as potassium. You can refer to this drug as a water pill. In other words, it makes you pee more. That is why it is referred to as a potassium-sparing diuretic. What is spironolactone used for? Spironolactone can be used to treat your high blood pressure. By lowering blood pressure, it helps prevent strokes and heart attacks. Having said that, this medication is not a first choice blood pressure medication. It can be used with other medications to treat heart failure. It can be used to treat extra fluid in your body, especially if it is due to a disease called liver cirrhosis or another rarer kidney disease called nephrotic syndrome. This extra fluid in your body is called edema. Another use for this medication is to treat elevated aldosterone levels in your body. Aldosterone is a hormone which your body produces. It is used in a rarer medical condition called primary aldosteronism. It can be used off-label to treat acne. Another off-label use is to treat male pattern hair growth in women called hirsutism. Here, spironolactone works as an anti-androgen. Spironolactone doses and administrations. The doses in form of tablets are 25 milligrams, 50 milligrams, and 100 milligrams. You can take this medication with or without food. Some individuals have nausea when taking this medication on an empty stomach. You can combat this by taking this in with some food. Must know tips and advice. Number one, if you're taking this medication, especially if you're older, like advice with all blood pressure medications, is that it can make you feel dizzy and lightheaded. So take your time when you're getting up from a sitting or sleeping position. Be careful when you're walking up and down stairs. Number two, spironolactone can increase your potassium. You have to be careful when you take in potassium-rich food such as bananas, potatoes, or oranges, or taking in potassium supplements. Your doctor will be checking your electrolytes, in particular your potassium, once in a while. You're probably asking yourself, what are the signs and symptoms of high potassium? Well, they are nausea, fatigue, weakness, chest pain, palpitations because of an irregular heartbeat, uncoordinated movements. Number four, spironolactone is a diuretic. It would be advisable to take this medication earlier during the day. If you take this medication in the evening or at nighttime, you'll be always running to the bathroom. 5. You should not use this medication for weight loss. The weight you lose is water weight and not excess weight due to fat. Number 6. You should avoid taking potassium supplements or salt substitutes that contain potassium, as you can run the risk of excessive potassium in your body. 7. Alcohol and marijuana can slow the effects of this drug. Follow up with your doctor if you're taking these substances. This medication, especially in higher doses, can cause gynecomastia. Gynecomastia means enlarged breasts. Gynecomastia may affect one or even both breasts. You will experience a breast swelling and pain. And if you're a man and you're listening to this, rest assured this condition is reversible once the medication is discontinued. If you're on this medication and have a pre-existing kidney problem and you are taking it with other medications called NSAIDs, such as ibuprofen, Motrin, or Aleve, you are at a risk of causing kidney damage or kidney failure. Your doctor will be monitoring your kidney parameters closely. This medication can cause certain electrolytes to decrease. The electrolytes which can be affected are magnesium, sodium, and calcium. your doctor will be following them with blood draws. And if you're interested in other blood pressure medications, check out this link above. All drugs may cause side effects. The goal of this channel is to educate you if you're on a drug and how it works and what you might expect in terms of common side effects. There will be always some people who will have no or only mild side effects. If you do have side effects, call your doctor as soon as possible to get his or her advice accordingly. Here's a list of medications that can interact with this medication, causing drug-drug interactions. This is not an exhaustive list, and if you're on one of these medications, please tell your doctor. Your doctor should check your potassium after 1 week of initiation of this medication, and anytime the dose of the medication is changed. Here's some of the blood parameters your doctors should be occasionally checking, as these can all be affected by this medication. If you're pregnant or breastfeeding, talk to your doctor about this medication, as this medication can cross the placenta and is present in breast milk. As this medication can block male hormones, it can cause the male fetus's genitals not to form properly. Therefore, do not take it when you're pregnant. Here's some of the side effects. Once again, this list is not exhaustive, but you'll have some idea if you're experiencing one of these side effects, which you're seeing down there. So call your doctor if you're feeling any of these side effects. If you're taking Spironolactone for acne, you should know that this medication cannot cure the disease, but it can manage symptoms, especially if taken for a longer period of time, that is several months. In women who are taking this medication to improve the thickness of the hair or even to treat hair loss, the treatment can take a long time to be effective, in fact several months. Well, take your health and have a good day. How come every time I do this, something else happens? I don't know what to say. I hear elephants walking around. In fact, is this my house? Become a hunter now. Is this like a comedy of errors? I mean, is there an elephant up here? It sounds like Niagara Falls and the elephant. Listen to this noise. It's not even Niagara Falls, it's Victoria Falls. Is someone like vacuuming?